It's time now for the Business Spotlight here on the WMAY newsfeed, and it's sponsored by the SIU Center for Family Medicine. Carrie Tucker is a family nurse practitioner, and we're talking about something that I really discovered for the first time last year and found myself thinking, why haven't we been doing this all along? Virtual visits with your healthcare provider. Carrie, thanks so much for joining us.
Hi, thanks for having me.
First of all, we just want to make sure we're always working with the proper and common definition. So what do we mean when we're talking about having a virtual visit?
So a virtual visit is any visit that is done over the phone, or it can also be a video chat. And that's between you and your healthcare provider when you aren't able to meet in person.
This is something that I think really picked up a lot of steam for people, and probably a lot of folks like me experienced this for the first time last year during the pandemic when people were a little more apprehensive about those face-to-face visits. That's one obvious advantage when you're in the middle of a pandemic. Hopefully that won't always be the case for us, but there are other benefits to doing the virtual visit. What are among those?
So this has definitely been needed for a long time, regardless of the pandemic. So for a lot of our patients in our clinic, they don't always have reliable transportation, or they could be have to travel some distance to come into our office. And it's definitely convenient. You know, a mom with several children at home, you know, she could go into a quiet room and give us a call about herself or her children. And then, of course, some folks just can't get out of their homes very easily for different reasons. And of course, you know, if there's inclement weather, it really helps provide continuity of care.
Are there situations where a virtual visit might not be appropriate? It might not be the best way for somebody to get the health care and evaluation that they need?
Yeah, that's definitely the case. In more emergency type situations. With COVID, there has been a lot of respiratory issues, for example. So we don't want anyone who's very short of breath be calling for a virtual visit that needs more emergent attention, or, you know, someone with chest pain. Because a lot of these virtual visits are done over the phone. There are, of course, video chats that we can do. But if something that we really need to visualize, it's not really going to be appropriate. So a lot of the virtual visits that we can do are things that people can explain easily about their symptoms, that we can get a good diagnosis for them.
We're talking with Carrie Tucker. She is a family nurse practitioner with the SIU Center for Family Medicine. We're talking about the benefits of virtual visits. And Carrie, do you find that these do provide the same quality of care that people are, in fact, getting the services, the diagnosis that they need? And how does that contribute to their overall health?
It has actually been quite beneficial. We've had a lot of patients who still aren't comfortable coming for face-to-face visits. Now, virtual visits aren't meant to completely take care of our in-person visits. That's obviously ideal, but it has definitely helped with certain things like medication follow-ups. You know, for example, you have a busy work schedule. To take off the time for work isn't always doable. So we can provide continuity of care by talking to patients to follow up on their medications. We can help with their health maintenance. So, for example, annual mammograms, we can order labs, any imaging studies that we feel like are needed. It can be done virtually. So, I mean, I feel like it is not the gold standard as far as seeing someone in person can do, but it definitely has provided that continuity of care that's really been needed during the pandemic.
I know in my situation, I got hit with a stomach bug last year, and it was, you know, during the pandemic, we knew that that could be one of the potential symptoms of COVID. So I didn't really want to go in and see somebody face to face. I also just didn't really want to leave the house. I just felt miserable, but I was able to get evaluated and get some medicine prescribed very, very quickly. And gosh, it worked out so well. But I know another thing that people have to consider is, how does this tie in with insurance? Is a virtual visit treated the same as an in-person visit? Is it covered by insurance? How does that all work?
So that's a good question. Actually, this past summer, a bill was passed that does require insurance companies to, they're required now to cover virtual visits. And of course, that the payment varies from insurance company. But generally speaking, a lot of insurances will cover copays that are much less than an in-person visit. I know myself, I actually looked prior to coming to talk to you, is that my insurance only requires a $10 deductible versus a $30 to $35 deductible.
And obviously, every provider is a little bit different and every situation is a little bit different. But if people want to find out more about whether a virtual visit is right for them and how to arrange one with their provider, what's the best way to go about doing so, at least for those who are patients there at SIU Center for Family Medicine?
So there's a couple of different ways. They're welcome to call our main number, the 217-545-8000 number. But also, one thing that I recommend for anybody, regardless of their healthcare provider, is getting connected through an online type service. For us, it's Follow My Health. And patients can send a message to set up an appointment through that as well. Granted, emergency visits, we don't want being sent that way. But so through this portal is a good way, or calling. Either one of those is a great way to schedule a visit.
There are lots of routine healthcare services that can be readily available at your fingertips without ever having to leave your home. And it is a great way to take use of the technology for overall improvement in health. Carrie Tucker is a family nurse practitioner with the SIU Center for Family Medicine. Carrie, thanks so much for your time. We really appreciate it.
Yeah, thank you for having me.
Here in the Business Spotlight on the newsfeed, WMAY on 92.7, 94.7, and 970 AM.